Hey, this is Dr. Stuart from Infectious Diseases at McLaren Bay. I'd like to talk to you about a potential treatment for COVID-19 that we have available at the hospital, actually for the last couple months, but we want to make sure that those of you who we've talked to about it before are kind of reminded of it, and also let any of you know that haven't heard about it know what we've got. So I know COVID vaccines are taking up much of everybody's attention now, but in addition to the inpatient treatments that we have available at McLaren Bay, we also have supplies of the Eli Lilly monoclonal antibody called Bamlanivimab. This is a monoclonal antibody to the spike protein of the coronavirus, and it has been shown to be of some benefit for high-risk patients early in the course of the disease before they develop a lot of symptoms. The data for this emergency use authorization drug came out of what was called the BLAZE-1 study. This study enrolled about 300 people to 3 different doses of the monoclonal antibody. It also enrolled about 140 placebo patients. The primary endpoint for this study was decrease in viral load over 10 to 11 days. There was not a huge change by 10 days in terms of viral load in people, whether they had received placebo or drug, but out to about 7 days, people did seem to clear the virus a little bit quicker. The endpoint that was used for the emergency use authorization was reduction in hospitalization in people that received the monoclonal antibody. There was an absolute reduction from about 10% hospitalization in the placebo group to 3% in the pooled data for people receiving the drug. This drug does have some safety, or I should say probably potential safety issues with hypersensitivity. Risk overall of serious adverse events was low and under 2%, but this does require people to come into our hospital to an infusion clinic that we've set up so that they can be observed during the infusion and for about an hour afterward. People that are approved for this drug are from age 12 and up. With respect to adults, anyone age 65 and above is considered high risk for progression to serious infection, so they can be enrolled without any underlying medical conditions. Patients age 55 and up can be enrolled if they have heart disease, hypertension, or COPD. For patients 12 and up, the high-risk conditions generally are obesity, diabetes, for kids, sickle cell disease, and congenital heart disease. For adults 18 and up, people with diabetes or underlying immune compromising conditions can be enrolled, but this is mainly then for people at high risk. There is a small window of opportunity to get them enrolled. Our criteria at McLaren throughout the corporation includes symptoms for no more than 7 days, and they have to be within 5 days of getting tested with an antigen or PCR test for COVID-19. Order sheets are available. Dr. Chapin is going to be going over some of the logistics of getting people in, but I just wanted to provide a little bit of the clinical data for you.
Good morning. This is Norm Chapin. I'm the Chief Medical Officer here at McLaren Bay Region. Daryl did a great job of talking about some of the clinical indications for the monoclonal antibody therapy, and I just wanted to give you some idea of the process that we need to have you follow when you're scheduling a patient for receiving this infusion. So first of all, as Daryl said, we have to identify the right population that will benefit. So if you have a patient who is within the 7-day window or 5 days of getting tested and they're not sick enough to be hospitalized, We will be attaching an order form to this email so that you have a copy of it. The first thing you need to do is review the fact sheet and go over the patient's information, fill out the order form, and make sure that the patient meets the criteria. We're then going to have you fax that information to our pharmacy here at McLaren Bay Region. The pharmacy team will review the information and determine whether or not the patient does meet criteria. They will then contact your office and inform you of whether or not the patient can receive the infusion. For the patients that can receive the infusion, we are going to have you call the central registration desk between the hours of 8 a.m. and 4:30 p.m. The registration staff do need to know the information about the patient, especially when the last date of infusion is. This will be based on information that you get back from the pharmacy, and that is based on the information that you gave them regarding the date that the patient developed symptoms and or had the test performed. Once the central registration schedules the patient for the infusion, we need to have you call the patient back and give them that information. We also need to have you inform the patient that they must enter through the emergency room entrance and that they must wear a mask the entire time that they're in the facility. Please also remind the patients of our current visitors policy. They will have to be in the hospital getting the infusion for 1 hour, and then there is a 1 hour observation period because of the risk of adverse events and anaphylactic reactions that Dr. Stuart referenced in his comments. We hope this information is helpful. The attachments to this email will include all the information that you need. If you have any questions, please contact the pharmacy or contact myself, and we will work through this issue with you. Thank you very much.